I love that new one.
And hello. Hi, this is Kathy Frey from IMCO, the International Integrative Maternity Healthcare Organisation. And a big welcome today to Dr. Julia Bartrop. Say hello.
Hey. Hello.
And I'm very, very pleased. We are very pleased to have Julia back again. We've ended up doing a little bit of a series with her because for those of you that haven't attended one of Julia's webinars before, you'll find out that she's quite an encyclopedia and so much valuable information. And so fantastic. And what we're going to be talking about today is a part 2 of acupuncture in relation to the first trimester, with quite a particular focus today on anxiety and depression, and also some other very, very relevant common topics like iron depletion, anemia, and indigestion, so and some other bits and bobs. So that is just wonderful. And just a reminder that if you're new here, we would love to know whereabouts you are in the world and your role as a health professional, or maybe you're a mum expecting a baby. So do go into the chat section and let us know. That's always fantastic for us to know who's where. And also just a reminder that down the bottom is a button with a Q&A button, and so you can go on there and ask any questions of Julia, and we'll make sure that they get answered before this ends today. And what's going to happen is that shortly from now, Julia's going to take over the screen, and she's got a PowerPoint which she will go through, and then we'll catch up at the end, as I say, with any other final information. So welcome. And for those who have not, for those of you who did not register to attend this as a live webinar, and maybe you're watching this months down the track, I just want to give you a little bit of an overview about Dr. Julia Bartrop. She's a mum of 2 and an acupuncturist, and obviously a Chinese herbal medicine practitioner, which is huge. And her main areas of interest are women's health and preconception, fertility, pregnancy, birth preparation, and postnatal care. And prior to studying Chinese medicine, Julia worked as a medical scientist. So today she is able to combine that knowledge of both the Western and the Eastern sciences. And I think that's just why, Julia, you've just got such a amazing source of information in your brain, because you've come from that background of both sides of the coin, so to speak. And so I'm going to let her tell you more about her background. So Julia, please take over and reintroduce yourself, and yeah, welcome along to everybody.
Okay, so just bear with me and let's hope this goes right. Okay, so welcome everyone. So as Kathy said, I'm a mum of 2. I am a doctor in Chinese medicine. So I studied at RMIT and did 5 years, and I have acupuncture and Chinese herbal knowledge, which I use with my treatment, especially in pregnancy and postnatal care. So today I'm going to chat about how acupuncture can assist in the first trimester of pregnancy, part 2. So if you were with me in the first seminar, the first couple of slides will be repeated, but for new people that haven't, I've just included them, so I'm going to run through them. Oops. Okay, here we go. So Chinese medicine has been around for thousands of years. So basically over 10,000 years. The classic texts that we have are from about 5,000 years ago. And TCM has always promoted a specialized treatment for women in pregnancy and postnatal care. So in the Western society, acupuncture is now starting to become more popular and more known about as, more people are actually seeking it out during pregnancy as well now. So within Chinese medicine, there's actually a window of opportunity to enhance a woman's well-being, and this occurs at three major points in her life. So one of those stages is pregnancy, the second stage is postpartum, and the third is menopause. So at these really three important pillars, we actually have the chance to improve a woman's health and vitality to an even better an even higher standard than what she was prior to getting pregnancy. And postnatal, we can actually reinforce this again and improve her overall health and vitality, and improve her health and her longevity of life as well. And then at menopause is the same thing. So this is really important because, you know, working in pregnancy, postpartum, and also menopause, these are the three major pillars of life where we can actually enhance, invigorate, and increase vitality and overall health in women. So as a general rule, in the first trimester of pregnancy, because it is generally more unstable, the first trimester, we like to see the client once a week for the first 14 weeks. So the reason for this is you've got lots of hormone changes going on, you're making a placenta, you're making a baby, and basically what we're doing is we're really nourishing the woman, we're looking after her emotions, we're also assisting the viability of the pregnancy. So we're nourishing the organs, we're helping the body to establish that pregnancy as well as grow a placenta. And why we say up to the first 14 weeks is basically the placenta, once it's actually developed, takes over from about 12 to 13 weeks, and then by 14 weeks the pregnancy is completely viable. So that's why we say once a week up until 14 weeks. So TCM is a preventative medicine. It's always been used as a preventive medicine, and that is the basis of its medical system. So when we're treating pregnancy, we're actually using acupuncture and Chinese herbal medicine, diet and lifestyle advice, breathing techniques to actually strengthen the mother and the baby and improve their health and make sure that everything's in balance, everything's working in harmony. We treat problems as they occur, but as it is a preventive medicine, if I've got someone in front of me, I'm looking at how things may occur down the track, like the third trimester, and I'm actually putting in points for treating them to prevent those things from actually occurring later on during the pregnancy. We use a variety of methods in the treatment of pregnant mothers, and this helps to promote fetal and maternal health. So this can be the combination of acupuncture, we can use Chinese herbal medicine, we can use herbal teas, we can use breathing exercises, we do diet and lifestyle advice, and we recommend exercises as well. And again, just reiterating that we see the client once a week until they are 14 weeks pregnant. What we can assist with, so as you can see here, there is a huge range of things that we can assist with. This is just some of the things. You know, if we get so nausea, fatigue, morning sickness, anemia is a really big one. I haven't done much on the PowerPoint, but I'm going to talk about it. Threatened miscarriage, so this was in part 1. I'm going to run through anxiety and heartburn and constipation today as well. So diet and lifestyle advice is a huge part of Chinese medicine, and we use it alongside acupuncture, and we use it to reinforce our treatment plan as well. So we also use the foods to nourish mum and bub, and we use the foods, so we're using the principles of using food as medicine. So from Chinese medicine, all food has energy, and all food has a temperature. So if you think of peppermint tea is cooling. If you think of ginger, ginger is really pungent and really hot. So we're using the temperatures of food to also help to treat the mother and any conditions or symptoms that are arising. So if you've got heartburn, I'm not going to tell you to go and have a ginger tea because that's going to make the heartburn worse. I'm going to go and say have a peppermint tea, and that will help to, one, put out the fire, and it's cooling, and it's going to help actually with the fluids and everything to stop that acid regurgitation as well. So during pregnancy, we focus on warming and nourishing foods and not having really huge meals, because that puts a lot of pressure on the digestive system. And again, rest in the first trimester is essential. So in the last one, I focus quite a bit on rest, but in the Western world, women don't rest. But this is one thing that I tell all of my clients: rest is so important in the first trimester. And by getting enough rest, you're actually nourishing your body. And this can actually help to reduce symptoms such as constipation, such as heartburn and fatigue as well. Oh, sorry, I'm running the wrong one. Hang on. Oops. Okay. So what we're going to cover today, I'm going to cover heartburn, I'm going to cover anxiety and depression, constipation, and anemia. So while this one is up, I just want to talk about anemia, because I treat a lot of women for preconception, and when they come in, I'm always asking them for blood tests. And one of the most important ones that we want to see is iron studies. So why we're focusing on iron studies is basically a lot of women are actually anemic before they get pregnant. And what happens is, as soon as you get pregnant, all the iron is going straight to baby, and baby basically depletes vitamin D and iron really, really quickly in pregnant women. So before they're even allowed to get pregnant with me, I like to see their ferritin levels, this is Australian terms, at 120. And their iron stores need to be middle of the range or higher up, because like I said, as soon as mum gets pregnant, all the iron and the vitamin D goes straight to baby. So
I might just interject at this point, because I'm a little bit passionate on this topic myself. I just want to throw some weight into this. It is quite common in pregnancy that around about sort of 24, 26 weeks, a set of bloods is done, and often an iron is included at that point. And that's where iron anemia depletion can get picked up. But it is absolutely way too late in the pregnancy to be doing a first test. Mm-hmm. And so although it's not so common, certainly with my own clients, I will always do a iron stores check with their very first set of bloods. Yeah. And because there's a couple of really important reasons why. One is because you're going to pick up anemia that's already there, mm-hmm. And so be able to treat it, but also it gives you a comparison at around that sort of 26 weeks or so. Because if you've got a woman, for example, who is sitting at 120 at the beginning of her pregnancy, and by 28, 26 weeks, she's sitting at 105. She's actually done really well in general terms of keeping up with her stores. But if she's a woman who started at 120 and by 26 weeks, she's sitting at 32, mm-hmm. You're going, oh my God, you're so not keeping up. Yeah. And it gives you a comparison. So yeah. It frustrates me, because it is just so common with midwives and with obstetricians that they don't do a first check until that second trimester, which is just crazy, because you want to know, you want a comparison. And those numbers that you're talking about, I have had women come into pregnancy and I've checked them at the booking, and some of them have been as low as 4. Mm-hmm. Yeah, and they have no idea. And they're probably, anyway, so I just wanted to throw that in there. I can't agree with you enough on that topic. I will zip up now and hand back.
Okay. Okay, so in relation to anemia, as we said, Chinese medicine is preventative. So, and with my background of working in pathology, I really reinforce this to my clients. So generally when they find out that they're pregnant as well, they'll do all the basic, STD check, the HCG check. And I'm also wanting to focus on that iron studies and make sure the iron studies is done as that first 6 weeks as well. Because if they're low there, I know exactly I need to nourish them with acupuncture, with points that will boost up blood production. We also need to nourish them with foods, so high iron foods. We need to make sure that their supplement, their prenatal, has an iron in it. So some of the ones at the moment have gone now iron free, which I really, really am annoyed at, because iron deficiency in pregnancy is a huge problem, and we actually need a lot more iron when we're pregnant than when we are breastfeeding. And a lot of women aren't getting enough iron, especially in the first trimester with nausea and vomiting. So what we do with anemia, so they will recommend obviously an iron supplement as well if you are anemic. But if you become anemic in the second trimester, you're looking at an iron infusion in the third trimester. So if you are really low, anemia has an added on effect. So you may need an iron transfusion in third trimester. And if you're anemic, it can also impede your breastfeeding ability as well, because iron deficiency can impede the breast milk production, and you're going to have more fatigue, more exhaustion as well around that, which is why I am, like Kathy said, I'm really, really passionate about anemia and these levels. So you want to make sure that they're getting iron in their prenatal supplement, that if they are vegetarian, they're seeing a dietitian or a nutritionist and making sure that they're getting the right amount of iron for them from their food that they're taking, and combining lentils and proteins and everything together to get that intake correct. The other thing is I prefer a liquid iron. It's more easily absorbed on the body. So there's new ones that have come out like Multifer and Spartan. If you are taking Spartan, you will need 4 sachets a day, and you need to take it with a vitamin C. Ferrograd C here in Australia is really good, but it causes constipation, and it's really, really hard on the digestive system, which is why I've gone to Multifer and the Spartan, and making sure that there is iron in the supplement as well. So the other thing to know is that if you're already iron deficient by 6 weeks of pregnancy, and iron transfusion is actually contraindicated in the first trimester of pregnancy unless they are absolutely so low that it is absolutely necessary to do. And when I mean really, really low, I'm looking at iron levels of 1 or 2 in the body, and that is just like, you need an iron transfusion right now. So this is why we focus on anemia, and I have noticed that with COVID-19 as well, more and more clients are coming in severely anemic and severely vitamin D deficient. So we're working with preconception on building all of that up before we're even getting pregnant, so that we're looking at stopping the add-on effect of iron deficiency anemia throughout pregnancy and postnatally as well. Now, I haven't written a PowerPoint up about that, but please go over and listen, and I'm happy to answer more questions at the end, or you can write me an email and I'll go through that as well. Okay, so heartburn. So heartburn is basically a burning pain felt when the digestive juices actually come up through the epigastric flap of the stomach and up through the esophagus. So some people can notice heartburn as a really strict burning, searing pain coming up through that esophagus. Other people might just notice a burning through the throat or a really bad metallic taste in their mouth. So heartburn can occur at any time in pregnancy. Clinically, I notice it more in the first trimester and more in the third trimester, especially as baby starts getting really big and pushing all the digestive organs up. So it can range from mild discomfort to severe pain and vomiting. And it can cause women to limit their food intake and lose sleep. Generally, heartburn's worse at night when you're laying down, because that gastric acid's coming all the way up the esophagus because it's flat. So we say generally boost your pillows up by 2 or 3 so that you're actually on an incline like that rather than completely flat. And basically, it's due to the changes in hormones of estrogen and progesterone, and they actually affect the whole digestive system and the motility and gastric production of the digestive system as well. So what can we do about it? So basically, with heartburn, as I said, it appears the first and third trimester. There are 2 main points that we can use. So if we look at the top corner, you've got CV12 in the middle. So how you find this is you actually come from the nipple line and put your hand on the point in between the nipple line, and then your hand on the belly button. And what you're going to do is you're going to come halfway in. So this point is actually Ren 12 here, and this is the empirical point of digestion. So this treats all digestive issues, and is actually at the top of the stomach as well. So I can actually get, so I'll do this in an acupuncture session along with the toe point, and we can put tacks on these as well, so that women can go away and actually press the tacks in between the treatment to help to assist with their heartburn at the same time. If the tacks come off, you can use a ballpoint pen for the one in between the toes, or you just apply pressure to CV12 to where they're comfortable for, holding it for 1 to 3 minutes. So CV12 we can only use in the first trimester, as from 32 weeks, baby's under the point, and we don't needle anything from where baby is, because we don't want to pierce into the uterus or hurt baby in any way. So the point in between the toes, this is known as stomach 44. So we use this one for reflux, acid reflux, for heartburn, also assists with nausea, any indigestion as well. This helps to treat it, and food stagnation. So quite often when we're pregnant, if you eat a big meal, you find that that food sits there in the stomach and is really hard to digest. So this is actually a really good point to help get that food moving through the digestive system, and to help the digestive system to actually digest the food. So as I said, these points will be used in an acupuncture session, and after the session we'll apply the press tacks. So the press tacks is a tiny little needle in a what you call the same material as a band-aid. So they stick on, and they will stay on for about 7 days until the client comes in again. The main point that we want to make is lifestyle advice. So eat small meals, avoid fatty, fried, rich food, highly seasoned foods. So you don't want to be having foods that are absolutely covered in like cayenne pepper, or, you know, really spicy. You don't want overly rich desserts or anything like that, or, you know, really creamy pastas. And avoid carbonated drinks, because the bubbles actually make that acid from the stomach a lot worse as well, and can cause more burping, more indigestion, and a flare up of that heartburn. Increase fluid intake. So when we're saying that, don't scull like 600 mils at once. You want to be sipping regularly. So take 3 or 4 sips, and then, you know, 20 minutes later, another 3 or 4 sips, so that you've constantly got fluid going in. So peppermint tea, as I said, is cooling, and that actually helps to put out that fire as it goes down, and to help with that acid reflux. So sleeping upright, so on that incline, and use your press tacks and the acupressure points as needed. So heartburn, I'd love to say that, you know, the old wild's tale is if you've got heartburn, your kid will have lots of hair. Unfortunately, it doesn't really marry true from my clinical experience. I wish it was true. Okay, so anxiety and depression. So this is actually huge. And has become a lot more prevalent in pregnancy over the last 5 years. So as I was doing research, it's actually really heartbreaking to know that 1 in 5 mothers experience perinatal anxiety and depression, and that's been taken from PANDA, which is the Australian Perinatal Anxiety and Depression National Association. And 1 in 20 fathers actually experience perinatal anxiety and depression. So I do find in general that there is an increase in anxiety and depression with women who have had previous miscarriages or a stillbirth. This is just overall in general, because of their experience. They are more highly anxious throughout each pregnancy that they have, and there is a lot more worry, a lot more anxiety around, will the pregnancy actually take, will I actually, you know, have a full pregnancy, will I give birth? So emotional changes are normal during pregnancy, and they can swing from joy to fear, to mood swings, to irritability, to times of anxiousness, to times of feeling overwhelmed. This is all normal. This is all part of pregnancy, and this is all part of the hormones. It's all part of that heart opening from Chinese medicine when you become pregnant as well. And yeah, so feelings of, you know, mood swings and changes in mood are normal in pregnancy as it goes along with the hormones. So from a Chinese medicine perspective, all of our emotions relate to an organ. So when we're talking about anxiety and depression, we're talking about the heart, and the emotion associated with the heart is joy, and the liver. So when we talk about the liver, the association is anger and frustration. And we want these organs to be balanced, and we want them to be in a positive emotion, not focusing on such the negative emotion either. So from Chinese medicine, everything is interconnected, everything is joined together, everything has a flow on effect with energy. And if everything's in harmony, everything's flowing really well, our emotions will come up, we're able to acknowledge them, we're able to go, oh, this is how I'm feeling, okay, let's sit with it, okay, what's underlying this, what do I need to do? However, when we're looking at anxiety and depression in pregnancy, we are looking at if the person is focusing on an emotion for too long. So they're in a constant state of anxiousness. So if this is lasting for longer than a week or longer than 2 weeks, this is not normal. And this is what we're focusing on. This is where anxiety and depression can start to flow on in pregnancy, and where we notice that there's starting to be an imbalance in the body. So once that imbalance in the body starts occurring, then it starts flowing on to all the other organs and all the other physiological effects of the body and how it works together with everything. So as I said, a focus on treatment in TCM is focusing on balancing the organs, and by balancing the organs, bringing them all back to their optimal function, which is then going to harmonize the body and allow the body to work optimally and function to its best. Okay, so in Chinese medicine, our heart is where our spirit lives, or the mind, or the spirit, or your soul. And as I said, the emotion is joy. So if the heart is affected in any way, so this is the organ is out of balance and it's not functioning how it should, then we can have issues sleeping, we can have heart palpitations, you can find that people are in a constant state of frustration, worry, and irritability. So as I've said previously in other webinars, we're always focusing on treating the emotions throughout pregnancy, because by treating the emotions, we're helping the body, we're helping the woman be in harmony with herself, we're helping to protect the baby and nourish the baby, because babies pick up on mum's emotions and what's happening throughout the pregnancy as well. So by helping the woman to balance her emotions, we are also enhancing baby's health and vitality at the same time. Okay, so Buddha's triangle. So this is basically a triangle on the wrist. So I'm going to hold my wrist up. Now you'll see that there's a line across here. Okay, so this is the point that we use. So heart 7, you'll come down from the little finger, and then it's just in here. And then you've got lung 9 on the other side, just under the thumb. And then pericardium 6 is 2 fingers, put it on the base, and then it's in between those tendons. So you can actually do that and hold. So this is a really lovely way of treating anxiety. It's really gentle on the body. It's really nourishing. It's boosting up the lung organ, and the lung organ's emotion is grief. So this is really, really good for women who have also had previous miscarriages or stillbirth, and there's a lot of anxiety around the pregnancy. Pericardium 6 also helps to calm the heart, and the pericardium in Chinese medicine is actually the heart protector. So we're working through the heart protector to calm the heart as well. And heart 7 helps to calm the mind. So it's a really lovely point. It helps to balance out the body and helps to bring the body back internally and down, and the woman into her own emotions and into a calm state where she can actually think clearly and go, well, hang on, what's actually happening? So these points together actually help to aid with concern, anxiety, and that overwhelming feeling. So to apply acupressure, you want to hold each point for 1 minute, and you want to apply this for 3 times a day. So for head points, we've got yin tang, which is up the top. I'll just move this so you can actually see. So we've got yin tang, which is just in the center here. So this is a really good point, and all of my clients throughout pregnancy automatically get this point. And if someone's talking too much and they can't stop and they can't unwind, automatically this point goes in and they are quiet within 1 minute. So what you want to do is, if I take my glasses off, it's right in the center of your third eye. So just put your index finger on, and then you're just going to rub clockwise, okay? And then once baby's born, or if you notice with little children, if they're really wound up and they can't get to sleep, the other thing is you can just gently stroke down, and that has a really good calming effect as well. So if women don't like to put pressure on that, I'll just get them to do that gentle calming stroke as well, and that calms them right down as well. So the main function of this point is to calm and allay anxiety. So it's going to help to decrease heart palpitations. It's going to help to decrease sleeplessness and that constant state of worry, that constant state of fear. So do 24 is just literally just in from the midpoint of the nose in the hairline. So this is used to calm the mind. It's used for mental disturbance, anxiety, fear, and over-worrying. So using yin tang and do 24 together is a really powerful point. And then we've got the Buddha's triangle, which is going to nourish the organs and nourish the functioning of those organs to help bring all of those emotions back into balance and help the woman to calm down as well. So the woman can actually use these points at any time throughout the day. I teach all of my clients how to do this, and I'll actually draw the crosses on and give them pictures of this one and just get them to do it throughout the day as they need to. So depression. So 1 in 5 women will actually suffer from depression during the perinatal period. And unfortunately, depression can greatly impede the happiness of being pregnant and in fact impede the whole pregnancy experience. So women who are depressed can have feelings of fatigue. You can notice that they fail to be not so enthusiastic about being pregnant and not very enthusiastic about life. So the depression can be caused by hormonal changes, or if they've had trauma, and again, if they've had a previous miscarriage or previous stillbirth, you notice that this is more likely to occur. It doesn't necessarily always occur, but I am on the lookout for it in my women. So the main aim from a Chinese medicine point of view is that we balance the liver organ to encourage the free flow of energy throughout the body. So the liver's in charge of sending energy and blood throughout the body. So if you think of a freeway, you're on a freeway, you're doing 100, the car's flowing nicely, there's no traffic, and then all of a sudden you come to a roadblock, you've got to put the brakes on. And this is what happens when energy gets blocked in the body. It starts to stagnate, it starts to slow everything down. So, and this can lead to those feelings of feeling really low, feeling really flat, no energy, and just having a foggy head, and just in general feeling really, really, really heavy. So ways that we can balance the liver organ, obviously we've got acupuncture. We also use our Chinese herbal medicine, but lifestyle advice comes into it as well. So we're using breath work, gentle walking and stretching. So any type of movement will get that blood flow and that energy flowing through the body. So we really want to focus on movement with people who are depressed. And breath work as well, because when we are stuck with anxiety and depression, we tend to only breathe into our diaphragm. We don't breathe deeply down into our belly. And by breathing down into our belly, we're oxygenating the system, we're oxygenating the blood, we're getting that energy flowing, and we're waking up the body as well by getting that oxygen in and by moving. So, and this helps to actually assist with depression. It doesn't prevent depression if you're already depressed, but it helps to lift that feeling of stuck. It helps to lift that feeling of being really heavy and really weighed down. So again, we work, acupuncture and Chinese herbal medicine and Chinese teas work amazingly for depression, but we do work in combination with a woman's GP if they're seeing a psychologist, if they're seeing a counsellor. So it becomes a team effort as well to support her during the pregnancy so that she can actually enjoy the pregnancy as well and live life to her fullest while pregnant. So depression points, so do 20 is right on top of the head. So the best way to find this point is actually put your thumbs behind your ears and then your fingers at the top, and you'll notice that there's just a little dent there. So what I'm going to do is hold my finger there and just in a clockwise movement, just rub gently. What this does is it brings energy all the way up to the body. So you're bringing energy, you're bringing blood to the brain as well. So we're focusing on stimulating the brain and the neural pathways in the brain as well to work with the emotions and also to stimulate feel-good hormones. So, and then this actually helps to calm the mind, helps them to feel grounded as well, and helps them to come back into their body so that they're not out there, they're in their body and they can actually feel what's going on in their body. So we do this in combination with Sanjal 3. So as I hold my hand, you've got your little finger and your index finger. You've got your two knuckles here, okay? So Sanjal 3 is literally located in between these two knuckles here. Now, this is a great one because this helps to move stuck energy in the body. So if you think of it, we're opening all the doors and windows, we're getting the wind coming in, or you're getting that roadblock, and we're basically just going, okay, we're throwing it out the door. So this helps to balance emotions, helps to move energy, and helps to lift depression up so that that woman can actually feel a lot lighter and not so weighed down. So I teach this to my girls and I'll do it during a treatment as well. But it's really important that when we are depressed that we are giving lifestyle advice. We're boosting it up with Chinese herbal medicine or teas. So I actually make a calming tea and a nurturing tea, and these are really, really good for depression. And I've got an uplifting tea as well, which also focuses on balancing those emotions at the same time. So this is safe. Everything is safe to do during pregnancy. And I get the ladies to do it as they feel that they need to. So women who have anxiety and pregnant, we need to help them to assist to calm their mind. So we're focusing on lifestyle issues. So gentle walking, yin yoga, perinatal yoga, gentle stretching, and finding something that helps them to calm down. So if that's watching comedies on TV, then that's good. If it's needlepoint work, that's really good. If they love drawing, get the pencils out, get them drawing. Singing's actually a really awesome way to help with anxiety, because we're actually getting that voice through the heart and we're actually bringing out that emotion as well, and it creates such a calming resonance for people, as such an amazing tool to use, especially with anxiety. We want them to find a craft that makes them happy, or something that makes them happy and something that makes them calm, something that they can do every day as a ritual and that brings them a sense of peace. So with anxiety clients, from a Chinese medicine point of view, we want them to avoid talking, because talking about it can increase that anxiety and just reinforce it. So we want them not to talk. We want them to find an activity that's nice, that's calming, that centers them and helps to calm them down. And if they're doing it daily, then this becomes an add-on effect and helps to reinforce that calming when they're doing that activity. So we want them to avoid stimulants. So we don't want them drinking coffee. We definitely don't want them drinking black tea either. We don't want them snacking on chocolate or sugary snacks, because this can make the emotions go from being calm to like up to down and really manic and all over the place, which we're trying to avoid. We're trying to keep them calm and centered. So with depression, so women who do have depression in pregnancy, generally you find that they use exercise quite a lot to help combat that depression, because when we're exercising, we're getting the dopamine and that serotonin released from the brain, which helps with the feel-good hormones. However, really high intensity exercise is obviously not recommended in pregnancy. If they've been running for a long time, I will say, you know, for the first trimester, okay, run. Once we get to second and third trimester, I like them to do swimming. We need to keep these women moving. They're a wood energy and they need to definitely keep moving. You'll find that some of these women will constantly be fidgeting, tapping on the floor, their legs might be tapping. So we need to get them moving, and the best exercises for them are qigong, swimming and yoga. Some clients with depression, we like to get them to talk. Talking the emotions help to bring out that anger, that frustration, and that irritation. We also want them to find a creative outlet to help them to flow that energy and to keep the energy moving. So gardening is really good. Cooking is really good. If they can go to a book club, that's really good. And the other thing that I've found is belly dancing, which is actually great, especially like coming into the third trimester. It helps to prevent pelvic pain. You're getting them moving, you're getting the energy flowing, and it's something that they can do. So dancing is really good for creating really good happy energy as well. So again, we want them to avoid stimulants, so avoiding coffee, your deep fried fatty foods, hot spices, your chocolate again. So we really want to focus on nourishing foods and foods that have vitality and avoiding processed foods. Okay, so I'm going to run into constipation now. So constipation generally occurs quite frequently in the first trimester due to the increase of the hormone progesterone. So progesterone actually affects the gastric motility, like I discussed back with the heartburn. So it slows everything down, everything becomes a bit more sluggish. And the reason for this is because all of the focus is on the body establishing that pregnancy and making that placenta as well. So all of the energy is down in the uterus, and digestion sort of gets a second glance in. So constipation can also be a cause of nausea and vomiting in pregnancy, and not getting enough food in. So technically, I don't really say this is constipation. It's more that they haven't got enough of the full stocky food going through. If they're drinking fluids and they're hydrated, and they're doing a poo every 3 days, I'm happy. But if they're starting to feel really heavy, really bloated, getting headachy, then it is a buildup of toxins, and that's more constipation. So some iron tablets can cause constipation as well. Like I said, the ferrograd C tends to cause a lot of constipation. So like I said, a liquid iron is much better if you get your girls on a liquid iron. If you've got Metagenics in your country, the Hemogenics is really good. It's vegetarian, there's iron in it, and it's easy on digestion. So our aim in Chinese medicine is actually to support an efficient bowel movement and to assist the body to eliminate the waste. So Sanjiao 6. So the best point for constipation in pregnancy, and anyone who's constipated as well, is Sanjiao 6. So this is actually on the back of the forearm. And so if I hold my wrist up, you've got this line across here as well. We're going to use our 4 fingers. Put the 4 fingers on the center of the line, and where that little finger falls is Sanjiao 6, okay? For some people, when you touch it or when you press it, it may be tender, and this is indicated that it is a really good point to use for their constipation. Please note that we do use other points as well, and constipation in Chinese medicine, there's different clinical diagnoses that we can use, but this is one of the major points that is really good for constipation in pregnant women and anyone. So I've just chosen like a general point to help to assist. So this moves energy in all 3 levels of the body. So the top, the middle, and the bottom. So it's moving through the stomach, it's moving through the small intestine, and it's moving through the large intestine to help to get all of those gastric juices going and to get that flow on effect and to help the people to release the waste. So when we're doing Sanjiao 6, you want to apply pressure. You want it to be quite firm, and you want to go in a clockwise movement, and you want to hold it for 1 to 3 minutes. And this point aids with the bowel motion and the bowel motility. So when we're dealing with constipation, a lot of it comes down to diet advice. So we do want to make sure that they're getting enough fiber in their body. If they can't because of nausea and vomiting, I will say, an 1/8 of a teaspoon of psyllium husks and just put it in water. So that helps to bulk up the digestive system and move stuff through the intestines. We want them to try and aim for a piece of fruit a day. Now, I don't mind if they're eating a mandarin over the whole entire day, they're still getting a piece of fruit in, which is going to increase their fiber. And then you've got your vitamins and minerals and your vitamin C in it as well. If they eat an apple over the day, I don't care. It's just, we just want 1 piece of fruit. per day in their diet. Drink fluids often. So like I said, with the heartburn, you want to be having a couple of sips of water every 20 minutes, every half hour. And this just helps to keep the fluids going, because sometimes if we don't have enough fluid in the digestive system, we can't actually put that waste through the large intestine. Please avoid laxatives. Don't ever take laxatives in pregnancy. It's really not warranted. There are other ways that we can help, like there's Movicol. If you can't use acupuncture, there's Movicol, but do try Sanjal 6. It works a treat. If on iron, as I said, move to a liquid iron. It's easier on the digestive system and helps to decrease the risk of constipation. Press Sanjal 6 a day, a minimum of 1 time a day. You can do it 3 times a day or as much as needed. Generally on my girls, I'll get them to wake up and press Sanjal 6, and they generally find within an hour they need to go to the toilet. So we can drink lemon juice in warm water 30 minutes before meals. So this will actually, the warm water actually invigorates the body and invigorates the digestive system and helps it to function. It starts building up that gastric acids and the gastric juices so that you can digest the food a lot quicker and more easily as well. And half an hour before meals, because if we actually drink and then eat, that actually dilutes the gastric juices and leads more, women are more then prone to having heartburn, that stuck food sensation, and also not digesting the food correctly, which then can lead to constipation. So within the diet, we want to include, so you can have dried apricots and dried figs. Dried prunes are really good. Incorporating sunflower seeds, olive oil, and nuts. So in Chinese medicine, when we're looking at bowel function, nuts and seeds are moist laxatives, and they help to move the passage of the waste through the large intestine and help with that large intestine motility as well. So I always get my girls to take a tablespoon of olive oil a day, so you can take that straight. Or I don't like you having salads, especially during the first trimester of pregnancy. So you can put some olive oil in some warm water, or just take a tablespoon of olive oil and just swallow it. And that's known as a moist laxative. You do want it to be a cold pressed olive oil, and that helps the function of the intestines as well, and helps as a natural way to aid with constipation. Okay, so summarizing, so acupuncture is safe and effective in all stages of pregnancy. Our focus is on improving mother and baby's health. TCM is a preventative medicine, so I'm always looking at how my girls are, where they are, and what I need to do to prevent things from happening further down the track. So like the 2nd trimester, the 3rd trimester, or postnatally. Acupuncture, we can't prevent miscarriage, but we can assist with threatened miscarriage and bleeding in pregnancy. I threw this in because this is part of the part 1, but this is something I really want to get out there, because not enough women know about this. And if we can teach the women that, acupuncture is an essential service and we can help in this way, then, that's really good. And it also helps with their emotions and helps them to feel empowered, because they know then that they're actually doing something. So again, diet and lifestyle advice is a huge part of our treatment. So we do use acupuncture, we use Chinese herbal medicine, but diet and lifestyle advice is one of the most important tools that we have, especially in pregnancy and postnatal care. And and I can't reiterate that enough. So here are my details. So again, I'm Dr. Julia Bartrop, and I am the owner of Rebalance Chinese Medicine. I practice here in Melbourne. Please go and have a look at the website. I've got lots of blogs, lots of resources up there. And again, my main focus is on women's health, fertility, pregnancy, and postnatal care. And yeah, I look forward to answering your questions.
Oh, that is just so fantastic. The questions that have come in, you've actually been answering as you've gone anyway. So we're all good on that. Isn't she just fantastic? And for those of you who don't know, Julia is actually part of our committee, our board here at IMCO. And so we are very blessed to have her and all of her amazing wisdom. Just so good. I love your reminder that feeling emotional in pregnancy, especially sort of in that first trimester, is absolutely normal. That's when we look at the amount of estrogen that we produce in a pregnancy, one pregnancy is more estrogen than a non-pregnant woman produces her entire life. So of course we're going to be emotional. We can't not be emotional, but it's that sort of recognition. I think you're sort of saying when anxiety or depression is kind of really haunting the situation for more than a couple of weeks, then that's kind of taking you to that not normal place, and it's going to start to affect the pregnancy wellness, organ function, imbalances through to the fetus, etc. So it's just putting that into perspective, isn't it? That emotions are a normal part of being a pregnant woman.
And in Chinese medicine, emotions are not good and bad. They just are,
Right.
and they're coming up in our body for a reason, for us to recognize it. And unfortunately, in Western medicine, a lot of us just sort of push the emotions down. So I talk a lot about, if you're feeling teary, it's okay. Have a cry, you'll feel a lot better. It's just that emotions need to be released. Or if you're feeling angry, great, shout, go hit something. So, express it, because if you express it, you get it out of the body. It's coming up in the body for a reason. And if we actually express them, then we're recognizing what our body is trying to tell us, and we're in balance with our body.
Yeah, and there's so much in the West of that sort of history culturally of the whole stiff upper lip thing, and also the terrible way that we just don't respect how essential it is in the first trimester that women rest. And certainly in the Asian cultures especially, but nearly all Indigenous cultures, the rest in that first pregnancy is so respected, and it's so not respected in European culture. It's I think it's more of a modern, it's I'm sure if we go back a few hundred years, it was respected, but it's certainly not now. And, there is an expectation that when a woman is pregnant, especially with her first, she's usually still at work. And of course, it's not a real valid reason to not be at work. Oh, I'm just feeling tired today because I'm pregnant. And the bosses are like, well, not my issue. So, get to work. So it's so important that women do absolutely everything that they can, isn't it, to rest and rest and rest and rest as much as they possibly can in that first trimester, and really listen to their body. Oh, I'm just feeling so tired. Well, you're supposed to be.
Yeah, exactly.
Yeah, I always compare it to when you have a cold, or particularly influenza, and the only thing you want to do is lie in bed all day, and that's because your body is so busy looking after itself. It needs you to rest so it can do that. And that's the same thing in this first trimester, isn't it? That your body is growing a baby and it's growing a placenta. And there's a whole lot of work involved, and so it wants you to rest so that it can do those jobs properly, and try and prevent a miscarriage. And when we overdo things, anyway, look, we're running out of time, but we can always talk so much. And I also, another thing I'll just throw in there, that there's some really, really good science that's come back. We know exercise is beneficial in pregnancy, but as a really just an easy thing to remember, if you kind of think in terms of 100 minutes a week, sort of divide it up into 3 or 4 sort of sessions, that's really an optimum. Would you agree with that?
Absolutely. And exercise throughout pregnancy actually increases, you have a better labor, you're a lot stronger, and then if there are any complications, you end up with a C-section or anything. Women who actually exercise all throughout their pregnancy and do 100 minutes actually recover much quicker And emotionally, they're much better. Their body's in a much better condition as well, which is why we do focus on exercise. And I actually work here with Anita Guerrera, who's a midwife and founder of Fit for Two. And we work together with our girls. And she's a bit, in making sure that they're exercising, making sure that they're staying fit all throughout their pregnancy, and starting fitness from 6 weeks once they're cleared. And working with their bodies. And it's just a proven fact that women that exercise during pregnancy just recover so much more quicker, and emotionally are not so prone to postnatal anxiety or depression as well.
Absolutely, and better, lower rates of gestational diabetes, lower rates of hypertension, which of course leads to preeclampsia, so lower rates of those. But at the same time, it is just that little bit of balance, because we do see those gym junkies, don't we, where they're actually overdoing the exercise. So if we sort of set a golden rule, probably basically almost virtually nothing in that first 6 weeks, and then after that it's about 100 minutes a week of gentle exercise. So your pregi yoga, your qigong, as you say, gentle swimming, if you're getting a whole sweat up, a real big puffing, panting, and a big sweat, no, that's too much.
Too much.
Yeah, that shouldn't be occurring. And another one thing I'll add in is with the iron supplements. So often, if it's a prescription iron, it's just not that great a quality, and they tend to be tablets. And so quite often, but getting that liquid iron, so agree with you. It makes such a difference. So, yes, you might be prescribed some iron tablets, but what we're saying is that sometimes those prescription medications are not as good by any means as ones that you may have to purchase yourself. And another one, because you mentioned some brands, which is great, but if those brands are not available in your country, another one that is quite global, which is very good, is Spartan, which is liquid sachets. That's another real good one, and that's all around the world in a lot of different places. But generally liquid is, if it's liquid, it's probably going to be a better solution, and more effective and less side effects.
Just with the Spartan, in pregnancy, you'll need 4 sachets a day, and it doesn't have vitamin C with it. So just make sure that you have it with some orange juice, or take a vitamin C with it, because it's really important that we have that vitamin C, because the vitamin C is actually needed to actually absorb that iron as well.
Yep. Absolutely agree. So and Spartan is like a liquid sachet that sort of, it tastes like metallic water, because it's basically iron-rich water. And so, it's great to just rip open the sachet, throw it down the gullet, and wash it down with, get rid of the taste with a good swig of orange juice.
Yeah, exactly. Or just put it straight into the orange juice and drink it like that. Yeah.
Yeah, absolutely. And that works very well. Yeah. So look, anything else that you are wanting to throw in there before we wind up? Anything else you want to add, Julia?
I didn't mention vitamin D. So vitamin D is really important in pregnancy as well. And I know that the World Health Organization have actually dropped vitamin D down to 50. I just want to say it's too low. So again, with my girls in pregnancy, I like to be up around 120. And so, if vitamin D levels that are about 50, it's too low, because again, vitamin D gets sucked up straight away, and vitamin D is really important for bone health. So just make sure that, you are taking a vitamin D supplement, and you get your vitamin D checked as soon as you get pregnant, and again in the 2nd and 3rd trimester. So because they're actually finding that babies are being born vitamin D deficient, and having to give them a vitamin D injection on their 2nd day of life.
Yeah, especially if you are in a culture that doesn't see a lot of sun directly onto your skin. So particularly we do find it worse with Muslims, and it's just because you're just not getting that same level of exposure. So look, that is just awesome. Thank you so much, Julia. Love you. And I'll just see, we've got one last question. What dosage of vitamin D would you suggest? Oh, okay, I think we've just sort of just basically covered that one. So look, that is just wonderful. Thank you so much, everybody who's here live. Thank you so much, Julia, for your time that you put into these webinars. I know it's so appreciated. And we'll see everybody next week, hopefully. Okay, bye.
Okay, bye.